All right, I want to tell you a few more things. First, they checked my vagus nerve when they here in Florida. And what they found was because my vertebrae were like out of whack, they were compressing my um, my vagus nerve, which caused a host of other symptoms. I have tachycardia now, which means that my heart rate is like off the charts. Digestion problems, like anxiety attacks. I wonder how many people understand the connection between how your cervical spine sits, your jaw, and your mental state. Because I think that the connection is way more significant than what's like commonly accepted. What's like, it's like
More than conventional wisdom.
more than conventional wisdom. There you go.
Yeah.
So, and they were actually able to see that when I was they took ultrasound images and they had me move my head into certain positions, and they saw that the vertebrae are just compressing the um, vagus nerve. And remember, I told you that there was this one night I went to bed and I like went to sleep with my head tilted to the left and I couldn't speak. Well, apparently, what happened, the vertebrae like was blocking blood flow to my brain, and that caused like me to get this like
Almost like
stroke.
blackout.
It was worse, man. I wish I wish I would like um go to sleep. It was bad.
Yeah.
It felt like somebody was compressing air into my head, and your entire nervous system is completely shut. It's bad.
Mm-hmm.
And why am I telling this to you? And when we were speaking about the jaw, the Starecta thing solved this completely. When I put this stupid thing in my mouth, all of the symptoms I listed, they go away. So that's just that. It goes to show the importance of your jaw position, because people talk about looks, and maybe the fact that you get like wider airways. That's all nice, but here is an example of somebody who got his health completely destroyed by it. So, I mean, I think that people should be aware of that. You know what I mean?
Yeah, they should be aware of the negative effects of poor spinal alignment that's caused by poor jaws. It's very rare, even, especially on my channel. I don't know if I've ever really discussed it, like how the jaws can affect spinal position, cervical spine position, and then how cervical spine position can flow through to the rest of the body in negative ways, such as what you're describing.
It could block cerebral spine fluid. It could block your blood flow. It could compress nerves. It's so profound, man. I've been struggling with borderline low T, and the reason for that, after like scanning my MRI, I understood that because of that the cervical spine was misaligned, it caused like increased hypercranial tension, which when that happens, a lot of times the fluids in your brain goes into your pituitary, and that's causing what's called an empty cell. And most doctors wouldn't know even how to diagnose that, because the pituitary works. It's a little bit like fluidy. It's soaked with liquids, but they think it's fine. It's very, very common. But if I think that was a major factor in my borderline testosterone levels. Now, I'm not like very low. I'm at I think at this point I'm like 400, 500. It's not low. I used to be 300. That was like borderline low. I managed to up it since. But still, I think that people are unaware of the fact that could even, like their jaw position could even change their hormonal state.
Right.
So I'm sorry, man.
No, it's good stuff, man. This is a really big deal. And I've had my own mysterious nerve issues that are probably related to positioning of my jaws. I have this perpetually compressed occipital nerve on the right side of my neck. it's very sensitive. If I'm not super careful, it gets really irritated. It's almost like it's being compressed on the inside at the spine where it exits the spine and goes to the periphery. And then if I'm not super careful in my motions, it gets even more agitated on the periphery, and then I get a headache. So for all I know, I mean, I've had two surgeries done on that nerve in the right side of my neck, and they keep digging and ripping it out and cutting it, but still there's like a deep pain in there, and maybe
You
it's
can
at
see
the
this
spine.